y'all. Today our NCLEX question of the day says, the nurse has attended a staff education program about caring for clients who have arterial lines. Which of the following statements by the nurse would require follow-up? So option 1 says, I will zero the transducer at the level of the phlebistatic axis. This is going to be an incorrect option because it's a correct statement. We do want to zero the transducer there. The phlebistatic axis is at the level of the right atrium, about the fourth intercostal space and the mid-axillary line where those two meet. If we zero it incorrectly, like too low, we will have a falsely elevated blood pressure reading and vice versa. Option 2 says, I will monitor for warmth and erythema at the insertion site. This is an incorrect option because we do want to do this. We want to monitor for infection anytime we have anything going into the skin. Option 3 says, I will disconnect the tubing when the client is ambulating. This is going to be our correct option. This does require follow-up. We definitely don't want to disconnect an arterial line. We have a lot of pressure behind our arteries, so we may bleed out of that. Additionally, we don't want to be disconnecting and reconnecting. That can introduce bacteria into the artery, which we want to avoid. So if our client does need to ambulate, they can take the whole thing with them, like they would a bag of like normal saline or something like that. And then option 4, it says, I will perform an Allen test before arterial line insertion. We definitely want to do this. This ensures we have good collateral circulation from our ulnar artery before we go poking around in our radial artery in case something goes poorly.